All right, time now for your health check. You know, the top stories and web searches across Texas for weeks now have included something related to mask mandates. Meantime, we see numbers of children hospitalized with COVID continue to trend upward. Kids are trying to navigate the start of school through Delta's disruptions. So I had to ask one more time about kids and masks in school. I spoke with Dr. Janice Orlowski, Chief Healthcare Officer for the Association of American Medical Colleges. Here's part of our conversation.
I wonder if you can settle this argument for us once and for all. Do masks work in terms of mitigating risk or reducing risk of transmission?
Absolutely, masks work. Does that mask help prevent, especially when there's a infection that comes out of your mouth? So we really do recommend that everyone who's inside of a school building, whether they're vaccinated or not, that they should wear a mask. And that even if it's not mandated, as a parent, you want to protect your children. It's the right thing to do.
My niece and nephew, they're in third grade, kindergarten. They go to meet the teacher, right? I mean, this is historically, traditionally a big deal. You're excited. And my sister sends me pictures. I'm like, why is that teacher not wearing a mask? Why is the child not wearing a mask? What does the data tell us about, the time around someone, even without a mask on?
Initially, we were saying 15 minutes, but now with the Delta virus, because the Delta virus, it makes so many viral particles and it spreads so fast, it's probably reduced. So it's less than 15 minutes around someone who has Delta, and you can be exposed and infected.
School starts last week. This week by Monday, hey, here's a letter that says, okay, Mrs. So-and-so, a child in your kid's classroom has tested positive for COVID. So what does a parent do when you receive that kind of letter? When should they get their kid tested? Should they get themselves tested? Oh my gosh, the kid went to a birthday party or saw grandparents the weekend before. So what is the process?
If your child has been exposed, rather than guessing about it or waiting for it, that you should go and be tested. Your child should, especially if you intend to go and see grandparents. Until the quarantine time is over and you're sure your child is safe, don't let them go into multiple different environments where they may be spreading the infection.
The appropriate window when you should get tested or when you should get your child tested if they do bring one of these letters home.
With the Delta, it seems like people are positive 2 days afterwards. And so what I would tell you is that the time period is still probably around the 3, 4, 5 day range, but you may get symptoms as soon as 2 because it's such a rapidly changing variant.
Dr. Orlowski told me a realistic timeline for COVID vaccines available to those younger children, so under age 11, is late this year, even early 2022. Researchers are still collecting clinical trial data. From there, the FDA analyzes the data, then the rollout. So this is a process that's going to take months. Okay, it's going to require your continued patience and doing what you can for now to mitigate risk. All right, we're going